According to the Alliance for Lifetime Income, a record number of Americans are hitting retirement age this year. And that means millions of them are going to start using Medicare. The feared Medicare. CBS News business analyst Jill Schlesinger joins us now and says people receiving government insurance still need to plan for major out-of-pocket expenses as part of our Money Matters segment, sponsored by JBL Financial. Good morning, Jill. How much can Medicare recipients expect to spend on their own?
We've got a fresh report out from Fidelity Investments which reveals a 65-year-old who retires this year can expect to spend an average of $165,000 in healthcare and medical expenses over the course of their retirement. It's up 5% from last year. It's more than double the amount in 2002 when Fidelity first started this survey.
I think this is two things that near retire or retired people learn very quickly, and that is two things. Number one, they thought they weren't going to have to pay taxes on Social Security. In some cases, that's obviously not the case. And also that once they're on Medicare, there's no more out-of-pocket expenses. Wrong.
Yeah. Wrong is right. And also that a lot of people erroneously think that Medicare is free. It's not. You pay premiums for it. So when you look at this $165,000 number, Fidelity says that 43% of it comes from Medicare premiums for Parts A and B. But then you've got 47%, which is co-pays, co-insurance, deductibles. Prescription drugs add another 10%. And this number, by the way, does not actually include anything for long-term care. And if you're married, it's 2 times $165,000 over the course of your retirement, not just one.
So how do we plan for something like this?
The way I always like to do it is to break it down by what happens today. So $165,000 sounds like a horrible amount, but if you look at today's dollars, it really translates into needing an extra about $600 per month per person to your planning. And this is what's really important. Planning is the key here. So a lot of people will say, well, I spend $3,000 a month. That's what I need in retirement. I'm suggesting to you, don't say $3,000 a month, say $3,600 a month. And if you're looking at saving for these future costs, a great way to do it is to look at a high deductible health plan that's paired with a health savings account. These are really tax efficient accounts. You can take them with you and use them for decades in the future. If you don't have access to a health savings account, maybe you create a separate account that's earmarked for health care. And this is a form of what we like to call bucketing, where you create an account for a specific purpose. Just try to push some extra money in there every month. Don't look at it. Make it a diversified portfolio. And when you do retire, hopefully that's grown enough to help float you throughout those retirement years for that extra cost of health care and medical care.
Great ideas, Jill. Thank you very much. I will add on my own to this because I know we're out of time, but everyone I'm talking to in my age group that gets on Medicare says, it's great. We're not trying to scare you about Medicare. You just need to be prepared that there are out-of-pocket expenses, but everybody's telling me they love being on Medicare. Jill, we love having you on the show. For more on the costs of retired Americans facing retirement, you can check in to the CBS Evening News tonight. We will also post this segment at firstalert4.com/greatday following the show. This segment, of course, sponsored by all the good folks, especially Jeff and his daughter over at JBL Financial. Aaron, I know you're out there. Give them a call, 314-863-0008. Or you can find them on the web at jblfinancial.com.